Good afternoon, everybody, and I'll kill this one right off the bat. It's Van de Meulenbroek. All right, thank you very much. There's an exam at the end. Whoever spells it right gets a $50 gift card. Yes, without further ado, go to the first. Okay, that's fine. Whatever, that's fine. So what I want to talk to you about today, we don't have anything to sell, basically. You'll understand that. We're going to expose to you an initiative that that's been instrumental to the success of our department, I think, over the last 4 or 5 years. And I wanted to give you a little bit of context of how that project came about and where we were and where we went from that journey. So I'll start back at 2017 when the Order in Council came up at the Prime Minister's office to say, we're going to take all the First Nations and Inuit Health branch out of Health Canada and put it into the new Indigenous Services Canada department that was newly created in 2018. My role in that, I was hired in 2018 at ISK to bring in this IT group into this new department from Health Canada into ISK. Now, the context was the First Nations and Inuit Health Branch was an entity on its own in Health Canada, so they brought that out. But the corporate services part, finance, IT, administration, that kind of thing, they did a prorated amount of 24% of those FTEs were brought into ISK. So put a line in the sand, 24% of IT from Health Canada went into ISK. That represented more or less about 40 resources, of which I got 12 warm bodies for 4,000 clients to support across the country. So you can understand what that represents in terms of a challenge. So I come up to this job and I look at this and I'm looking, okay, I got people all over the country with nobody to support them. So let's bring this group up. Anyway, long story short, we managed to bring the staff up to the whole group, but morale and culture and everything else was a challenge at that point. And not the least of which was the fact that the nursing group, which was also part of the health portfolio within health at the time, was traditionally a group that was likely, well, for the lack of a better term, ignored, basically. A complicated group, they're far away, they're never connected to the network, not really tech savvy for more or less. So we get into this new department and pretty much the same thing was perpetuated. In the sense that, nurses would call up and say, I have a problem with my computer, well, we'll send somebody right away. It's like, well, you don't really understand where I am right now. So the challenge was to make the department understand that these nurses had probably never been into a corporate office, were not physically connected to the network, were not in the same type of work environment that the traditional worker was, which was the culture of ISC at the time. They had never had, give you an idea, when we came in to ISC, they had 0 mission-critical systems. When I say mission-critical, these are systems that if they go down, Canadian lives are at risk. When FNIB came in, we brought that number up to 17. So that in and of itself was a challenge for them to understand culturally what that represented in terms of uptime and support and maintenance and all that kind of thing. So with that, we were faced with a challenge of having to deal with nurses who were calling in or who had a new 1-800 number to call to get IT support. Once they got there, they didn't completely understand what they were asking for. Also, given the fact that if they had a compensation issue, they had to call a different number. If they had a problem with their medical equipment, they had to call another number. And if they had something else that's they had a bunch of different numbers, and basically what they ended up doing is not calling at all, and just basically complaining about it. So what they did is 2017 and 2018, when the nursing group was losing nurses as we went, in steps in Janice and knocks on our door and says,
Thanks. Yes, so in 2017, the Public Service Employees Survey revealed that while the vast majority of ISK's nurses were experiencing job satisfaction, the same could not be said about their level of satisfaction with their organization, with their employer. Approximately half of our field nurses and 3/4 of our nursing management team expressed a desire to leave the organization, citing workplace stress and a lack of support as key contributors. And so Jean-Marc mentioned that, he was tasked with a workforce to support of 4,000. Approximately just shy of 1/4 of that were nurses. And 75% of those nurses worked in the field. So huge change culture for our colleagues on the corporate side, and very foreign experience for the nurses trying to relate to the new environment. So, as was stated yesterday, many great things come with a simple idea. Our idea to combat workplace stress and to respond to our nursing workforce was what they were telling us was in fact the Nursing Services Response Center. This was designed as a dedicated team of technical experts armed with contextual knowledge, and I can't reinforce that enough, right? The thought that a technician could pick up the phone and a nurse could say, I'm Sue and I'm calling from Sandy Lake. Oh, hi Sue, we talked last month, and how are things in Sandy Lake? Is the connectivity better since we've changed something? The fact that we could arm teams with contextual knowledge so that it wasn't a standard robot call with every, you're on 4th floor? Yeah, I'll be there in 2 minutes, as Jean-Marc mentioned. So that was huge in the context of the design of this particular project and team. So their whole purpose of this team was to respond to the unique IT, security, compensation, and other related needs of frontline service providers in a fashion that was timely and allowed nurses to keep their focus and efforts on providing quality care to the community population they served. While many might suggest that the cost of such an initiative would far outweigh the benefit, our business case demonstrated that funding this initiative at 1/6 the annual salary cost per nurse far reflected a cost savings as compared to the estimated turnover of 1.5 times the salary cost of an annual nurse on turnover. Not to mention the cost of productivity and, of course, the quality care to patients. Your go.
So, I know, and I come back again. So, Janice comes up to us and says, well, I have this idea of forming up this IT support team to go out to nurses and provide the IT desktop support for them in their health centers. And so we sort of went a little bit back and forth. Okay, what does that look like? We formulated more or less the amount of resources we would need, FTEs, that kind of thing. So what happened was I had, like I mentioned earlier, I had the entire IT support team across the country doing that. Some folks in that group were formerly from Health Canada, so they knew a little bit of that contextual knowledge. So they had some of that background around, again. So what I did is, along with my director at the time, before I stepped in, we brought the senior folks of IT across the country, that from Atlantic to Edmonton, in a boardroom in Winnipeg for a 3-day workshop on formulating this new NSRC IT team. So I pretty much sat everybody around the room and we did like a SWOT analysis. For those that don't know that, so it's like strengths, weaknesses, opportunities, and threats, and basically identifying what the things you do well, what the things you don't do, and what's out there that could make things better, right? To sum it up. And so we did that, and then we sat down and we talked to all these senior IT folks and to say, what would you want this team to do given the challenges that Janice and Laura had exposed about what the nurses were facing? Added to that the technical knowledge of the people that had that contextual knowledge as well, background on what the nurses were faced with. Some of them had already been to some of those stations, but for the most part, a lot of these stations had never even seen an IT technician on site. So anyways, based with that baggage, basically, we had all these people, like about 15 or 20, 17 people or so around the room, spent a couple of days going through all of these things and what should we have these technicians be able to do? What are the skills they should have? We went down to like jackets and hats and all that kind of stuff, right? And how we would get there and the whole thing, the travel thing. And what came out of it, and remember what I said earlier about having 14 bodies and having to bring that up to 40. Morale was kind of at a low point at that point, and building a team relationship was a little bit different as well. So what happened was, after that 3-day conference where we had everything sort of sorted out, and we had a good of a roadmap in terms of how we would form up that team, what type of skills we were looking for with the process and everything else. Also the fact of what level knowledge and skills that are we looking for? Are we looking for like super high techs or like, middle of the road? So what came out of that is that the comments that I got after that meeting was nobody had ever asked my opinion about how we should do IT. Across, like unanimously, everybody said, every time my manager wanted to do something, he would just tell us to do something. And he never asked my opinion about how I would do my job. And that, for me, was a revelation in terms of, like, I just did what I wanted to do and like, what I thought was a good idea. But what turns out of it was those 14 people went back to their respective regions and told the story of what happened for those course of those 3 days, and we built a team from that ground up. Like from that, it permeated across the organization to have this IT team, and I finally gel and say, we have management now that listens to us for real. And what happened like after that, and that's just 2019 or so, and if you remember the calendar, we had a kind of an event for a couple of years following that, but, but anyway. So this is pretty much the groundwork that we did to form up that IT team, and then the rest of the NSRC group that Laura's going to mention came out of the woodwork from that front. So I'll let you go with that. Oh, it's one for you? That's okay. I'm sorry. I'm losing that.
Okay, so what is the NSRC? So as we mentioned, it's a team of corporate service providers that understand the unique challenges of that nurses face in a non-government workspace. It is a brand known for its one-stop shop approach and commitment to tackling nurses' issues, regardless of how big or small those might be. With just one number, a nurse can call and be confident that our team will be on the other end of that line to answer their call, to assume the burden, and to solve their issues so that nurses can return their focus to their patients. So, the timeline. We had some critical times. Nope, don't go anywhere yet. So 2017, as I mentioned, the survey came about. Jean-Marc set the context of where the organization had come from and the challenges. Our then ADM presented me with the challenge of coming up with a solution. She asked me, quite frankly, if you could redefine the business model, what would that be and how would it work? So, you roll up your sleeves, you spend 2018 and 2019 doing the research, engaging with my colleagues, and we form a business case. We socialize the concept and the case. We secure buy-in from early adopters in the department, management, senior leadership in the organization. 2020, we received support to launch our proof of concept, just in time for COVID lockdown. That was fun. Okay? But in any event, things prevailed. In 2022, we were successful in our proposal for budget funding. It was at that point that I gracefully exited stage left and turned what was once an idea and now a reality over to Laura and Jean-Marc and many others to deliver a really great thing that started from a simple idea. Over to you.
All right. Thank you. Sorry, I'm short. Okay, so at this point I did what I was told. So what you're seeing on the screen now is a broad overview of the NSRC team. So today we're talking about IT, but we actually deal with compensation issues from our nurses, occupational health and safety and security. And you'll see in the visual that the triage team is right in the center. And that's where they should be, because they're a group of case managers who receive phone calls, emails from the ISK nurses, and then they reach out to the corporate partners to get help. So really, when a nurse calls in, it's like passing the baton. They pass the baton to the case manager, please advocate on my behalf so I can get back to patient care. So the case managers will take that case and they will work with their corporate partners to make sure that that gets resolved for the nurse. And not just resolved, but we loop back with the nurse to let her or him know that it's actually been taken care of. So you'll see on the peripheral, we also have a data team. We have a project team, and in future we hope to add a biomedical team and a procurement team. So just an idea of volumes for all NSRC cases. We had just over 1,000 cases when we started in 2020, and this year we're trending towards about 5,500. And of these cases, about 40% are IT. And over to you.
So, so what we did at the time, given the fact that nurses call and they at that moment have the time to call, given the added advantage of having that one number to call for whichever reason they would like to get support. So, but the number one being IT. So a lot of times when technology doesn't work, you need help right away. So when they would call for IT, we devised a system where, trying to figure out a way where, okay, when they call and they need to talk to an IT tech, how could we get them to talk to an actual IT tech as opposed to the triage person at the front end? So in comes in IceBar, which is a product from Bell. Let's say Computer Talk. Yes, Computer Talk. I think on the back end with the Bell call manager system. So essentially, what it is the triage person at the front end of the 1-800 number picks up the phone. Is your issue IT? Yes. Hello. All the technicians have this software on their desktop, and it tells them when they're online, when they're not online, they're on break, whatever, they're on a call and such. So when you see somebody's in green, for example, available, I'll flip your call over to Ralph or to Ann or whatever, who's available at this time. And they hot swap the phone, the call directly to that technician who's waiting online. So they get help right away when they call. That for us was a key element in having that white glove service of when you get service right away. And that served greatly in improving the quality of their reception at the end and their confidence that they would actually get help when they would call. As opposed to I would call and I have to leave a voicemail and I leave an email, it goes out into ether somewhere and I never get a response back, or somebody gives me some incongruent answer, let's call it. And so with that technology, we were able to capture a lot more things at the front end. And do you want me to talk about the triage? Sure. Yeah, when you come in. So let's introduce a little bit of AI here, somewhat. With the triage people calling in over the course of this rollout over the last year or so, they've done their own bit of machine learning, let's call it, because as people call in with this particular issue, an IT issue, which is usually fairly simple to solve, they can solve it at the triage point, as opposed to having send it off to an IT technician. For example, I don't know, I need to log into that little man on the bottom screen of bottom of my screen there. Oh, that's your VPN, that's your Entrust client. You got to right click and do this and that, enter your password, thank you very much, that's it. So they were able to get that knowledge at the front end, low-end skills, but I mean, it's still something that's major for the nurse at the end that doesn't know what's going on, right? So we were able to have that front end offload some of that work from the back end IT techs, and offload some of the more complex stuff to them when it was necessary. So. Yeah, so I think that was a big win for us, and I think it served also as a purpose for, as I mentioned in the intro, I'm also responsible for the National Service Desk, which deals with about 45,000 calls a year, but they're still on the phone, voicemail, email thing. They don't have this IceBar thing. They don't have, so I'm using this system as I'll say a litmus test or a proof of concept, for lack of a better term, to see how we can make this work and transpose that to the rest of the organization to improve that part of the service, right? So I'm giving you a little bit of the IT lens into like a corporate solution that we managed to partner with and doing. So I'll let Laura continue with this because there's a lot of other good things that came out of this system as well. So.
Yeah, sure. Thank you. So Jean-Marc mentioned the warm transfer. When an IT call comes into a case manager, we warm transfer that over to a waiting IT tech. And as Jean-Marc mentioned, this is really important because we've developed almost like a translation service. So when the nurse calls in with, I can't log into that little man with the key in the corner of the screen, the case manager knows that means for the IT tech, here's how I'm going to frame it for the IT tech so they actually know what the nurse needs access to. So the case manager first will listen to the nurse, understand the issue, summarize the issue, and then transfer it over to a waiting IT tech. At the same time, they create the help desk ticket, they assign it to that tech. And the other thing that's going on in the background that's really important is we have a Teams chat that all of the case managers are on every day, all of the IT technicians are on every day. So they're constantly teaching each other stuff. So Jean-Marc mentioned that the case managers are able to sort of self-resolve things when that call comes in. It's actually 13% of the calls that come in, the case manager can resolve right away. So that's actually pretty big. So it's resulted in less wait times for the nurses, so they don't have to, hang on the phone while a patient's waiting for them. They can just sort of pass that baton and get back to the patient. There's no dropped calls. Well, not a lot. There's a couple, but there's not a lot of drop calls. And just really positive feedback on the whole process from the nurses. And next. So just some stats. So we have over 900 ISK nurses. And in 2022-23, over 3,500 tickets were created. In 23-24, 3,100 tickets. And this year from April 1st to present, we have just under 2,000. So just to give an idea of the volumes. Since the original survey in 2017, which sort of sparked this whole idea, nurse satisfaction with IT has increased across the board 21%. So I think that says a lot for Jean-Marc's team and also our team. And in the 2023 survey, 84% of respondents indicated that they are satisfied with the NSRC, and 90% would recommend the NSRC to their colleagues. So we're pretty happy with those stats. We think that speaks volumes. And this is just some feedback from our nurses. I won't read them all, but basically this is telling us that we're doing what we set out to do. Our nurses are coming back with really positive feedback. Issues that they've had for years, they finally have resolved, and it really, really plays into nurse retention, which is super important for our team. And with that, I will hand you over to Liz Andruff. Oh, yeah. Sure.
No, it's okay. Oops. Just bear with me 1 second here. So my name's Liz Andruff. I have the pleasure of being the departmental coordinator for the IT Apprenticeship Program for Indigenous Peoples. And I'm just going to go over a couple of different things about the program to share the progress we've had, how we've also been able to be interconnected with the Nursing Services Response Center, and that partnership has really not only created opportunities for some individuals to gain an education in the IT sector that might not have had that otherwise, but it's also providing support directly on site at health centers, which means not only supporting our nurses directly on site, but also other people who might be working there who aren't necessarily employees of Indigenous Services Canada, again, so they can really focus on that great patient care versus how come my cell phone isn't working right now, or I can't get connected to this printer, or any of those aspects. I'm not an IT person, so I won't even pretend to bring up any other things. So here, this is just some beautiful maps that our partners over at Employment and Social Development Canada. They're the founders and the leaders of this program. Here are some maps that are just demonstrating. The one on the right of the screen there, that's where apprenticeship opportunities are actually in play as of today. So there's a substantial amount of individuals who have been hired in a variety of different communities. And the map on the left, where you have quite a few more red dots, that's where we've received applications from to participate in this program. So individuals, Indigenous individuals from different communities who'd like to obtain that education in IT. They have a passion for it. They might have some previous experience. They might have taught some things to themselves at home and in their community, and they'd like to get this, more formalized education. So just as of this summer, ESDC was able to celebrate for this IT apprenticeship program applications received from every province and territory within Canada. So that was pretty big. This program from ESDC, so a couple of notes that my colleagues have asked me to share with you. So the IT Apprenticeship Program for Indigenous Peoples is a groundbreaking government-wide initiative. It's led by Employment and Social Development Canada. It focuses on enriching the Government of Canada's digital workforce by benefiting from the talents and perspectives of Indigenous peoples. In this 2-year apprenticeship program, First Nations, Inuit, and Métis people receive on-the-job training while acquiring the skills, experience, and certification necessary to meet the Government of Canada employment standards for the IT group. The program, primarily created by, with, and for Indigenous peoples, was intentionally designed to do different. It weaves Indigenous practices, building and nurturing relationships, and supporting participants throughout their apprenticeship. As leaders in IT, you can make a difference. Some graduates have expressed an interest in working in the private sector, within communities, and Indigenous organizations. If you're interested in hiring a graduate or an apprentice, you can definitely reach out to me, and in this deck, you'll see their contact information, their website. You can reach out to them directly, and they can support you through any of those opportunities. If you'd like to learn more or engage with the Office of Indigenous Initiatives from ESDC, who's responsible for the implementation of this program, please visit that webpage as well. If you have individuals that you might know in your communities that might be interested in it, just by clicking to this webpage here, there is a link on it, which you're not seeing at the moment because I didn't screen capture that into the deck, but they can click through there and it walks them through their application process as well. No. So as you heard just moments ago from my colleagues from the Nursing Services Response Centre and the IT team, the contributions that that team makes with the extra added layer of beginning our participation and delivery with the IT Apprenticeship Program, we've been able to create these IT apprenticeship opportunities within Indigenous Services Canada, which I've got to say there's over 80 different government departments, agencies, ground corps that are all participating, so it's not just us. That we've created these not only in urban cities. We do have some opportunities, for example, in Regina and Winnipeg and Edmonton or Ottawa. They're also right out in remote communities. The idea being that when and where possible, opportunities are provided to individuals so they can stay in their communities, maintain those connections that they have in their communities, those supports, not having to uproot themselves, and still obtain this education, which has also been recognized and supported by many private sector companies as well. So let's see our, okay, this is mostly working. So just a quick timeline here. So in 2020, late 2020, Indigenous Services Canada, actually Jean-Marc's directorate started participation with ESDC to contribute to some of the ideas and formation of this program within the Government of Canada. And then shortly thereafter in 2021, they began with their first apprentices. In 2022, we were able to start with our first apprentice in St. Teresa's Point, Manitoba, right at a health center to provide support right there. And then now we've moved on to as well a special 3-semestered program so that individuals are not just going through your IT support or operations stream. They have a chance to gain experience, whether it be in application development, information management, all of these different areas in IT. Again, not an expert in IT, so I'm not going to pretend to know that whole list. That's been great. At this point, we have over 10 apprentices. We're looking to expand further and also looking forward to the future where we might be able to help train and support having an Indigenous IT person in every community, and where we can do that, whether at our own department, whether it's through the collaboration with other departments and communities and leaders, that's where we're working towards. So thank you. Any questions about either the Nursing Services Response Centre or IT Apprenticeship Program? Oh, please go ahead.
Just for clarity's sake, you have to understand that within the IT field in the federal government, for those that are not aware, the minimum requirement to actually get their foot in the door to get even pre-qualified for an IT job is obviously a high school degree and 2 years of post-secondary education. Those 2 years are the one that's, I'll say the barrier, basically, either geographical or whatever, situational, that prevent a few or some Indigenous peoples from moving from their community to get the higher education down south or wherever. So the ESDC has put forth this program with the consort of Treasury Board to say those 2 years as an apprentice will qualify for those 2 years of post-secondary education. So that gives you that ticket to ride, basically, to apply to a government job. You can take that and work in the public and private sector, and that's fine, and that's okay. So, but at the end of those 2 years, also, there's a mechanism by which the apprentices that went through the apprenticeship program successfully are now in a priority pool. So any and all departments can go into that pool and grab somebody that's out of that, the freshly issued from that department as a priority. So if an IT1, for example, which is the entry level, and typically, it opens up a department, rather than picking somebody from a random pool somewhere, they have to go into that pool first to get candidates from that pool, I guess. So just for clarity's sake, and yeah, I thought that's important for us to outline that.
Excellent.
So I guess I answered my own question.
Thank you so much. If you have questions after, we'll be around this afternoon. Thank you.
Thanks, everyone.